University shows that 10 billion coronavirus vaccines have now been administered across the globe. Oxford University has been keeping a tally since vaccines were first rolled out. In Gauteng, the province continues to register the highest number of new coronavirus infections in the country, followed by the Western Cape, Limpopo and KwaZulu-Natal. The National Institute for Communicable Diseases says that more than 1,200 new cases were recorded in Gauteng during the latest 24-hour reporting period. More than 3,700 cases were reported nationwide. The N.I.C.D says another 47 people died from COVID-19 related illnesses in the last 24 to 48 hours. All right, let's get some perspective then on the COVID-19 cases and how South Africa is doing in terms of dealing with the pandemic. We're now joined via Zoom by Acting Director of the National Institute for Communicable Diseases, Professor Adrian Puren. It's always a pleasure to see you, Prof. A very good afternoon to you. Thanks for being with us.
Good afternoon to you and to your viewers. Thank you very much for the opportunity.
Prof, how would you say that South Africa is doing currently in the fight against COVID-19? I mean, I must tell you, Prof, I've taken time to make some of my own observations. And apart from, the mask wearing, I am seeing people relaxing quite a bit. And, going back to, I'd say, normal pre-COVID-19 in terms of behavior, in terms of, let's just, for example, talk about social distancing, for example. I'm not seeing very much of that, and I'm sure that's having an impact on progress that might have been made. So where would you say we are at this time?
And so overall, I think we are out of the so-called fourth resurgence, if you like, or the fourth wave. I think that's clear. And I think that there's ongoing transmission, as we can certainly see, although I think today's figures for yesterday were certainly slightly higher than the previous days. So the overall average, 7-day moving average, has certainly increased slightly, but not dramatically. And there still is that what we call the uncoupling in terms of hospitalizations and deaths. I think it's really distinct in terms of the numbers of cases. So again, we're not really relying on the case to tell us the whole story. I think it's part of the story in terms of the trends. Yeah. But I think really critically is really looking at the hospitalizations and deaths. And that tells us that that still is very distinct from our previous resurgences. But you're quite right. I think that if we're going to become complacent, I think the ongoing transmissions will see that, but the extent to which that will necessarily overwhelm the hospitals and so forth is something that we really need to keep our eye on. So I think we still need to encourage people, I think, to continue and not to let their guard down in terms of, for example, the mask wearing. Wearing them appropriately, wearing the correct masks. And I think the physical distancing certainly also plays a role, as well as the ventilation of venues, for example, and offices. I think those are still critical components. I think that people think that the pandemic is over. It's not over. We certainly have come through this fourth resurgence. It's really difficult to predict, I think, what will happen with regard to this virus in terms of its evolution. So far, what we're seeing in circulation is the variant of concern and some of the sublineages. But again, we're not sure what those lineages really mean. So I think it's really important for us as South Africans still to keep to not become complacent, because it's not over yet.
And I don't know if the N.I.C.D is picking up the same thing, but I've noticed, as I read the news here, that, it seems that the COVID-19 numbers are fluctuating. You'll see, a rise and then a fall, very irregular. And I wonder if that is something that the N.I.C.D is looking at. And also, maybe you could talk to us about what the cause of that is, because, we get relieved on one side, and then the next day something else is, is different, and really how those numbers are really sort of calculated.
Yeah, so what you're seeing are the natural fluctuations that we would see, because again, the policy around testing varies by province, and the reasons why people go and test, especially if you're asymptomatic, doesn't really add to what we're currently seeing. So we would certainly see fluctuations on a daily basis, and therefore what we look at is what we call the 7-day moving average, and that tells us a bit more. It smooths out the curve to tell us really whether or not the trend is really downward. And I think the overall picture from the so-called 7-day moving averages is that we are certainly looking at a downward trend. We also look at the positivity rate as well, and that certainly has been declining. But critically, and you're quite right, is to look at what could be changes that we are seeing. So I noticed, for example, in Limpopo, it's certainly declined, but there seems to be an inflection. So again, we would have to look at, for example, clusters of cases. If there's greater mobility, we know that children have gone to school now. Is that adding to the numbers of cases as well? So those are the sorts of things that we will be looking at. So far, there's no dramatic change that we can certainly see in terms of the cases. There's no dramatic inflection in terms of or rise in cases at this particular time. So those are the sort of things that we will be looking at. And we'd also be looking at, as I said, looking at hospitalizations and deaths, because I think those are very important. And really closely linked to that is our vaccine campaign. Again, who's ending up in our wards? Is it people that have been vaccinated or unvaccinated? What is the relative contribution to that? Because that, again, is a very important public health intervention, is the vaccine. In fact, it's our major intervention. Again, looking at those numbers, again, I think it's really important for us to be encouraging people to take up the vaccine. And if you've not been fully vaccinated, to have your full course of the vaccine. And those that are now eligible for boosters, I think it's really important that we encourage those individuals. And especially, again, the focus is really who ends up in a hospital is really the older age groups. And so, again, we really need to look at those individuals, encourage them to become fully vaccinated and or have their boosters. Because I think with this particular variant, I think it's really clear, the evidence is really clear that boosters certainly contribute to protection.
All right. Prof, thank you very much for giving us your time. Always good to hear your sober analysis and input on the issue. Much appreciated, sir.
Thank you very much for the opportunity.
All right,
Thank you.
That is Professor Adrian Puren. They're speaking to us, of course, about the COVID-19 numbers, and he is the Acting Director of the National Institute of Communicable Diseases. Well,